Siskiyou Community Health Center had its humble beginnings as a Takilma People's Clinic in the Illinois Valley of Southern Oregon. This rural community's need for healthcare spurred the relocation of Dr. Jim Shames from Portland in 1973. Over the years, Siskiyou has grown to become a full-service FQHC with clinics in Grants Pass and Cave Junction, 5 school-based health centers, and 3 healthy family locations. In celebration of the 50th anniversary of providing healthcare to the residents of Josephine County, Siskiyou gathered a few of the people integral in its founding to share their stories.
So I want to give a little background about the mood we were all in when the clinic started. I lived in Santa Barbara. It was the peak of the Vietnam years. I'd had a newborn baby, and in the middle of taking care of him, there was riots. We'd gone to a Lamaze class at the time, and there were 2 other couples who also had newborn babies. And we said, let's move to Oregon. So we drove up to Oregon, and in 24 hours, a realtor pointed us to a big piece of land in Takilma. We had 24 hours to decide to do it, and we did it and moved there in 1972.
It was a really different community. People were, as Sue said, it was during the whole Vietnam War. There were a lot of young people who had said, I'm giving up on this country. I'm going to move to the country, and we're going to create our own systems. We had a number of community meetings, big circles, where we talked about how are we going to take care of ourselves? What are we going to do? And about that time, there was a mobile van with a state epidemiologist that came into Takilma and said, when there were over 100 cases of hepatitis reported, and it seemed like it was becoming an epidemic, we were sent down here by the state to see what was going on. When that doctor went back to Portland, he was working in a clinic with Jim. And he said to Jim, well, you'll know this part, but basically there's this community in Southern Oregon, and they're really trying to educate themselves about how to take care of themselves medically. And if you had any time on your hands before you start your residency, that would be a great place to go.
And here's this community that was doing everything from scratch, right? We're gonna rebuild society as we want it to be. We're gonna build our own houses. We're gonna have our own kids. We're gonna have our own school. You know, and the box on have our own healthcare was left unchecked.
We had what was called Monday night classes in the early days, and Jim modestly said he didn't have much to teach us. He knew a lot more than we did. And he would draw on the blackboard different systems. So one week it was the digestive system, and another week it was the heart and circulation. And we honestly thought we were going to be on our own. We didn't know Jim was going to stick around. And we were trying to learn the basic anatomy and physiology of how the body works.
We wrote grants to get a birthmobile, which you'll see was an old, funky old ambulance that we turned into the birthmobile, and I painted that picture on the side with the pizza pan and a hand and a baby on top, and it said, Takilma People's Clinic, we deliver. We delivered, my best guess was close to 2,000 babies through all those years. And part of the remodeling of the clinic was to build a birthing room. And for 15 years, we were the only licensed out-of-hospital birthing center. In Oregon, yes.
I had a vision of becoming a midwife, and I decided to go through nursing school and get some basic background in health. So I was going to nursing school in Ashland, and I kept hearing about this rural clinic in Takilma that was doing home births. One of my patients came into the hospital with some of the Takilma midwives, and I finally had my opportunity to meet some of the Takilma clinic staff. So I did. Finally stayed for a clinic meeting and said I would really love to join you all. Can I? May I? But they said, yeah, but just know that we can't provide you with a place to live and we can't pay you any money.
There was no money. We got grants for things. We got grants to refurbish the clinic. We got equipment. We got birthmobile. We never got money for salaries. And we would have a donation can on the desk. And at the end of each day, we'd dump the money out and we'd talk in a circle. Okay, who needs it the most tonight? Really, it was that way. It's like, well, my electric bill's due, or my kid, needs new shoes or whatever.
I remember a person from Health and Human Services came and met with the office staff at the clinic and said, we want to help you. Do you know you can bill for the deliveries you're doing? No. And they said, but the only catch is you have to have the same fee schedule. You can have a sliding scale, but you have to have some given set amount that you charge for birth. And that was sort of the beginning of having a fee for services. But for many years, it was all donation.
So we got extremely lucky. Children's Trust Fund out of Oregon had a $40,000 grant. That was big money to us. So we wrote the grant, received the $40,000, and started doing home visiting services to moms. Then they found out that Oregon Health Plan was going to provide them with medical care, not just for their child, but for themselves. And that was a shift in general. There was so much demand at that point for medical services at Siskiyou Clinic for both adults and children. There just wasn't enough people. People that had never had medical care before in their life could all of a sudden be treated for a medical condition that they maybe had suffered with for 15 years. The same for their children. Their children could get dental care. They could get eyeglasses. So it was really a groundbreaking moment for everyone. And I see that as a kind of push where the clinic really exploding the need for this, for service expansion at that time grew.
So when they hired me, they had just gotten a grant to expand coverage in a school-based health center. And so I worked at the clinic full-time for about 9 months, and then I started a school-based health center at Lorna Byrne Middle School in Cave Junction. And now we have school-based health centers in all 3 schools that are in Cave Junction, in addition to North Valley High School in Grants Pass and at Grants Pass High School. So that program has really expanded and serves the kids of the community well.
In the meantime, clinic decided, and you see these pictures that have been shown about the construction of the clinic in Cave Junction, which was just miraculous for us to get to help design a building that fit our needs, and then eventually the outreach building, which is next door. I have a feeling of outrageous pride every time I drive into the clinic. Every time I go to Grants Pass and drive into that clinic. Every time I go to Medford and say, amazes me. And I know with COVID, it's been a long time since we've had all of our clinic staff together. But the last Christmas party or whatever it was, there were hundreds of us. And every one of you has some part of why we're here doing this. It's amazing. And thank you to all of you.
I mean, it takes a lot of courage and faith to actually act upon the premise that healthcare is a right and not a privilege. And that's what I saw these people doing, giving people, whether they had money or not, to this amazing care. And I'm so grateful to have been able to participate in that for 25 years. It was, like Joy said, we grew up together. We learned so much. I've learned so much. I'm grateful that this is being carried on with people that have hearts like yours, that you care so much about the people you serve, because it is changing their lives to have somebody be there for them.